Now I need to explain one more circulation, that is coronary circulation. Very important, though it is a part of systemic circulation. It is very important, guys. Let's understand what is coronary circulation. It is the circulation of blood in the blood vessels of the heart. Look into the picture here. There are coronary arteries represented with red color. A small blue color veins are visible. They are called cardiac veins. Try to understand. Coronary circulation deals only with the heart. Its blood circulation deals only with the heart. We have seen pulmonary and systemic circulation. Pulmonary deals with the lungs and systemic deals with the rest of our body. But here coronary circulation is going to deal only with the heart. What happens is, even a heart requires oxygen, even heart need nutrients. So this is supplied how? How it is supplied? This is supplied through coronary arteries. Coronary arteries will supply oxygenated blood. How? Let's see. We have two things here, coronary arteries and cardiac veins. Coronary arteries supply oxygenated blood to the heart muscle. How? It comes from aorta into coronary arteries. We have seen aorta in our previous while looking into pulmonary circulation, also in systemic circulation. Aorta is the main artery through which oxygenated blood flows from heart to the body. During this pressure is exerted, due to which valves inside the heart forces the blood into the coronary arteries. How it happens? See, during diastole, the increased aortic pressure above the valves forces blood into the coronary arteries and hence into the musculature of the heart. Now I have used one word, diastole. To understand what is diastole, I will give you one simple task. Keep your hand on your chest. Just use your hand and keep on your chest and just listen to what your heart says. What it says? It says two things. One is love, second is dub. One is beat, second is rest. Heart is beating and resting. Just listen to that. It's just a word, rest, but usually heart won't rest. It puts pressure to push blood out. In medical language, we have two things, diastolic blood pressure and systolic blood pressure. Let's understand what is diastolic blood pressure and systolic blood pressure. This is very important because it is related to BP. Nowadays, we are seeing so many BP patients who are coming with high BP, low BP. That is very different topics. In future, I will definitely do a videos on why high BP and why low BP. Now let's understand what is diastolic blood pressure and systolic blood pressure. Diastolic blood pressure refers to the amount of pressure in the arteries while heart is resting in between the heartbeats. Where in case of systolic blood pressure, it refers to the amount of pressure experienced by the arteries while the heart is beating. Have you anyone seen normal BP range? Like blood pressure is usually written as 120 by 80. That is the normal range. What is 120 and what is 80? Why it is measured two times? Two things. 120 refers to systolic pressure and 80 refers to the diastolic pressure. Now here, because of this blood pressure, coronary artery is getting blood into it, which in turn supplied to the heart muscle. If you see in this diagram, in this picture, coronary arteries are connected to the aorta, red indicated by red color. Whenever this heart pumps, there is a pressure. Due to this pressure, blood, oxygenated blood is flowing into the coronary arteries. Small arteries, you can see this. Due to this pressure, blood is flowing into the coronary arteries, and that blood is supplying to the heart muscle, and heart muscle is getting oxygenated. Along with that, it is getting the nutrients from the blood, nutrients present in the blood. It gets absorbed and then it gets energized. What next? It also releases carbon dioxide. Heart also releases carbon dioxide from its muscle, and that we will see next. So here what you need to understand is, whenever heart will be happy if your blood pressure is normal. Because of the blood pressure, your heart muscle is getting blood through coronary arteries. Now let's see, we have seen coronary arteries. Now cardiac veins. As I said, even heart muscle releases the carbon dioxide. It gets deoxygenated. This deoxygenated is released into veins. What cardiac veins does? It drains away the blood once it has been deoxygenated from the heart. Friends, remember, every muscle of our body breathes oxygen. Here, heart is also doing the same. So deoxygenated blood is released into cardiac veins, which is carried back to the heart chambers, that is right atrium. From here you can see these blue colored cardiac veins indicated here. From here it will go back to the heart chamber, that is right atrium. Again this blood flows back to the lungs for oxygenation and removal of carbon dioxide. Once it is removed, again it gets oxygenated and come back to the heart. What happens if blood is not supplied to the heart muscle through these small coronary arteries? What happens? Let's see. It leads to coronary artery disease. Let's understand what is coronary artery disease. It limits blood flow in your coronary arteries, which deliver blood to your heart muscle. If the blood flow is limited in coronary arteries, coronary artery disease is caused. How it is caused? This is caused by plaque buildup in the walls of the arteries that supply blood to the heart. Plaque is made up of cholesterol deposits. Plaque buildup causes inside of the arteries to narrow over time. This process is also called as atherosclerosis. Guys, this is very important. Coronary artery disease has becoming very common nowadays. As per one of the US NIH, elderly peoples and also common people, 1/3 of all the deaths in the world results from coronary artery disease, that is CAD. What's happening? Let's understand. Look into the picture. Here we can see coronary artery section shown on the right side. It is indicated with a rectangle and section taken from the coronary artery of the heart. Here you can see the blood is flowing through the coronary artery, but blocked blood flow due to plaque buildup in the artery. Plaque buildup is indicated with somewhat wheatish color. You can look into the right hand side. Healthy heart muscle is red color, in red color. On the bottom side you can see dead heart muscle indicated with brown color. You can look, you can compare both the pictures. On the left hand side heart and also right hand side the section taken. So the brown color which is shown here, that shows due to the blockage of blood supply to the heart muscle, it is becoming dead. Cells are becoming dead. It is unable to oxygenate. It is unable to breathe. Nutrients are not stopped supplying to that part, due to which all the cells and muscle in that part of the heart is becoming dead. Due to dead heart muscle, heart loses its ability to pump the blood. What happens is, it will lose its ability to pump the blood. In turn, there is a chance that circulatory system fails. In turn, that can cause even heart attack. So did you got, guys, how important is coronary circulation? Coronary circulation itself happens because of the pressure exerted by the blood flow within the chambers of the heart, and due to that pressure, blood enters into the coronary arteries through aorta. Actually, due to pressure, its main aim is to pump blood to the body through aorta. It is going through aorta to the body, but due to the pressure, it is coming into the coronary arteries and it is supplying automatically to the heart muscle. How beautiful the God has created this human body system. That's all about coronary circulation and coronary artery disease. Don't miss the next video where we study about human blood, blood cells, RBC, WBC, platelets, hemoglobin, blood plasma. Hit the subscribe button and join our community of knowledge seekers. Don't miss out on future insights and tutorials. Click the bell icon to stay updated.